Let's talk about Flow's ability to improve procedural success in GI. The goals here are increasing completed procedures while also reducing poor prep. So groups using Flow typically see enhanced care through comprehensive management of their GI patients. And as we mentioned a second ago, some of that looks like improving prep and reducing cancellations in acute settings, but we also have found Flow's ability to support chronically ill patients. So how is she doing that? Well, Flow engages, manages, and monitors patients with personalized and frequent check-ins, as well as real-time education and instruction. And what that means is a reduced clinical burden and better resource utilization for the practices using Flow. So how is Flow supporting patients in acute settings like colonoscopy prep? Well, Flow will initially introduce herself and then offer scheduling support, prep supply shopping, prep day execution, as well as answers to many frequently asked questions. And for chronically ill patients, Flow is able to check symptoms, offer medication reminders, capture readings, and encourage and educate patients along the way. For the care teams who use Flow, they will be able to see alerts and trends and notifications that are all triggered within the clinical dashboard. And that dashboard will also offer complex analytics and the ability to integrate with whatever EHR platform is used by the practice. So let's get into some specific examples. Here you can see a patient has gone shopping at the pharmacy and realized that they've forgotten their shopping list. In the moment, in real time, Flow will reproduce the shopping list and also offer advice on substitutions for anything that is sold out at the pharmacy. Next, you'll see that Flow reaches out the day before the prep, offering advice on what foods the patient can eat, as well as what they should do about their medications. Finally, you'll see that Flow turns a static sheet of instructions into a dynamic conversation on the day of prep. Flow will reach out at specific intervals throughout the day, giving instructions on what to do and how to do it. And finally, what you'll see is for patients who are chronically ill, managing medications and symptoms, Flow not only nudges them to take their medications, but she will also probe to find out what might be standing in the way of them continuing on medications, whether it's cost, side effects, or accessibility. And she will route patients' questions to the right source, whether it's the pharmacy or the practice itself. So let's get into some of the numbers, because Florence has been able to demonstrate time and time again an ability to reduce cancellations as well as drive higher completion rates thanks to the fully completed prep that patients experience. We also see patient satisfaction scores increase, as well as an increase in practice revenue based on the fact that less patient rooms sit empty and more patients arrive fully prepped and ready for their procedure. Here's the clinical dashboard we spoke about a minute ago, which is going to identify patients who have trends, alerts, or notifications that the care team should focus on. Every message sent and received is logged and captured, as well as every data point captured by Flow. And these data points can be imported into the electronic record either as trend level data or as individual data points. And there's also a robust analytics dashboard that looks at population level data. But let's get back to these numbers, because these numbers are why customers choose to add Flow to their GI team. Time and time again, Flow is able to increase completed procedures, reduce turnover time, and increase patient success scores for all patients using Florence. So if your goals are to do those things, to increase procedural efficiency, to reduce cancellations, to support those patients who are chronically ill, Flow can do that with education and encouragement and real-time support and answering of questions. And all of that will improve your workflows and reduce the work on your care team. If you have any questions, please reach out to the Generated Health team.